What's up, y'all? It's Dr. Mia getting ready to start our Ageless Intimacy. And I have the wonderful Coach Joseph with me. And today we're going to be.
Where's the microphone?
You just hit it.
Did I?
Yeah. Oh, it ain't plugged up.
What up, though?
Yeah, just leave it off, actually. All right. So giving people time to get into the room. Hope y'all are having an amazing, oh yeah, all kinds of glares for my little Christmas tree. Hope y'all are having an amazing holiday week. It's not that it's a glare. But it does look better, doesn't it? Okay. Yeah. Hope y'all are having an amazing holiday. Today, we'll be talking about enhancing wellness and intimacy with supplements and hormone health. And it'll be me and Joseph. If you don't know, I'm Dr. Mia. You're a B3 specialist and board certified gynecologist at Mibella Wellness Center, where we offer gynecology to women and adolescents, as well as hormone balance with hormone pellet therapy for both men and women, intimacy services, weight management, laser hair removal, and total wellness with our supplement line, again, for both men and women. Our goal is to help you live well, age well, and experience everlasting intimacy. You want to introduce yourself, Joseph, to the people? Are you good with my intro? Okay, so that is Joseph. He is our male health and intimacy coach. And when I don't allow him to introduce, he talks about me because he says I talk too much. Then when I ask him to introduce himself, he doesn't. Y'all ladies know how it goes with these wonderful, lovely husbands of ours. So let's talk a little bit about supplements and hormone health. I didn't have my supplements right here with me, but let's just talk about the importance of supplements for men and women and how it plays such a huge role in hormone balance, wellness, weight management, energy, and all the other things. So if you have questions, please put them in the comment section. Let us know that you're listening. If you have questions, we are here to answer them. And so I guess the first thing we would talk about is, Joseph, as far as supplements, what do you think is the hardest thing for men and women as far as supplements? I know the answer. It's taking them. It's remembering to take them and putting them in your routine.
And I think the other thing is knowing exactly what you should be taking. I think sometimes, I come out of the era of one-a-days and multivitamins and things like that. And sometimes those were, and they were much better back then than they are now. It probably wasn't as many fillers in those supplements as they are now, but I come from the era when we had the women's one-a-day, the men's one-a-days, and men took multivitamins, stuff like that. But now I think it's even more important that you take the supplements you need versus what's given to you. My question would be, like you said, that, the biggest part is having a routine to take your supplements every day. That's the biggest part. But I think even more importantly, it is making sure you're taking the correct supplements, because we hear, we never hear anything bad about supplements, but we do hear people say things like, I don't know if I should or should not be taking this, but I'm going to take it. And maybe you shouldn't be taking it based on whatever is going on in your body. I think it's just important to take what your body needs versus what people say you need, I think one of the things that we do that's good for our patient base is we do a round of tests that tell us everything that you're missing in your body. And then that way you can provide the correct supplement for
and
that
I
person.
think it's the test, the lab test. And like you said, also with the test includes the questions and the review of systems and figuring out what's going on with you. So, hey, are you more tired? Are you having more joint pain now? Are you not sleeping as well? Like, what's really going on symptom wise, as well as through your lab, so that we know what you need. So a few things that I would say that most people need, especially during this season where we're trying to build our immune system, trying to keep away all of the flu and the COVID and the RSV and all of those other things. is that we need to do some things to build the immunity. So one that most people need to replace, if they're not replacing it, they probably need to, is vitamin D3. You know, that's something we can test for in your blood work. We can see if you have what your vitamin D3 levels are. According to the lab reference, it should be 30 to 100. For my patients, I recommend they try to keep it over 60. And that's high enough with the studies that show that it decreases the risk of cancer. It helps to build your immune system. It helps with sleep. It helps with energy. It helps with mood. It protects the bones. It decreases, and it helps with energy. So many things that vitamin D3 does. And the main thing is it does prevent cancer and it builds your immune system so you're less likely to get sick.
Yeah. And I want to say this before you go on. This is fact-based information. This is not what we think should be done. This is based on facts and studies. The studies say that this particular D, as in dog 3, will help with these certain things. So we don't do anything based on, we feel like this works well for us, it'll work well for you.
Right.
We do things based on fact-based science, fact-based medicine.
Right.
So
and what we've seen in our own experiences and what works well for our patients too, but it's still, like you said, fact-based because we've already researched it to get the right information, and then we tried it to see that it works. So vitamin D3 is one that everybody should be doing.
So D3 again, just to recap, what does it help with?
It helps,
and we suggest that they're over 60 in that.
Yeah, so we want your range over 60 so
right.
you can actually get your blood drawn and see what your vitamin D3 levels are. And then we want them over 60. Normal is up to 100. Now, some people are over supplementing, and I'm seeing some people with super high levels. So we want to make sure that we are monitoring when we're taking the vitamin D3. Right. But it protects the bones, it protects the heart, it helps with sleep, it helps with memory, it helps with mood. It helps with energy, and then it decreases your risk of cancer and getting, bugs in the environment because it builds your immune system. So vitamin D3 in itself does a lot, and everybody should make sure that their levels are good. And if they're not, replacing it, especially during this time of year. If you have normal levels, you should probably be doing about 5,000 IUs a day. If you are low, you should be doing about 10,000 IUs a day.
What are IUs? For us lay people,
that's just international units. That's just what it comes in.
Right.
And you don't really have to know that. It
right.
just instead of 5, milligrams, it comes in IUs. So a lot of supplements do.
But it will say 5,000.
But it'll say 5,000. So 5,000 if your numbers are over 30 already. Right. If they are low, then if they're in the low range, 10,000. So if they're like 30 to 45 or 50, I would go ahead and do 10,000 a day. Recheck the blood work in a couple of months. If they are less than 30, I would take the prescription strength, which we can write for 50,000 IUs per week, and you just take it once a week. And if it's super low, like 10, 12, 15, like way under 30, I have my patients to do twice a week for 2 months and then go to once a week.
I don't know what mine is. So.
Yeah, I know what yours is. Yours stays on the lower end, and that's why I try to make you take it. So and the other thing that we can do is make sure that we have our supplements kind of set up in a little baggie. So I buy the plastic baggies, and that way I can make our supplements for the morning and the afternoon, and we can just grab them and go. So that makes us more likely to take them. When I was doing that, we were really good about taking our supplements. So definitely vitamin D3.
All right. So we're talking about immunity, because we're in the season of cold, flu, and COVID, by the way.
Yeah.
Because COVID still is out
RSV.
here. And RSV, whatever that is. But
it's
those things. So so right now, during COVID, our key products was D3. What was the next one?
Vitamin A is another good one.
Vitamin
and remember, we do have a supplement line called Ageless Balance by Dr. Mia, Cowan MD. And the reason we have that supplement line is because I don't want you just grabbing stuff off of the shelf.
Right.
I want you to use high quality supplements that actually really work. So the next one is vitamin A. Vitamin A helps with skin. It also helps with your immune system. We also have the elderberry. So elderberry. You've been exposed.
And we've been taking elderberry around here for a long time. Yeah. We rarely get sick.
And we even drink it in a tea called Immunity.
Yep. By Dr. Michelle.
Right, by Dr. Michelle, Free-ality.
Free-ality.
So that's the vitamin A. And then another one is zinc. Zinc helps with skin, and it also helps with your immune system. For men, it helps actually with fertility. So it helps with sperm motility. Right. So definitely the zinc for the immune system during this time of year. And then vitamin C, something very simple. You can get it naturally from your limes and your oranges and all those things, but you can also supplement during the season to make sure you're getting enough. And then I still recommend everybody have just a basic vitamin, but you just need to know what's in the vitamin. Yep. So those are for your immune system.
So just to recap, we got vitamin D, vitamin A, zinc, and C.
And elderberry in some form or fashion.
In some form or fashion. So that's what we were taking during COVID.
Yeah, and we didn't get sick at all. We got COVID one time.
We got sick because we decided to go out in public and go to a big party with 250 people with no mask.
And talk on the microphone.
And talk on the microphone.
10 other people talked on and we didn't clean it first.
And we got sick.
But outside of that, I was seeing patients like 3 days a week, and I did not get sick from COVID.
But we wear masks. We wore masks.
And we washed our hands and washed our hands. So for now, washing your hands, wearing your mask when you're in closed environments, and making sure you're supplementing your nutrients because you don't get them in the food.
So Doc, all those, that's our immunity bundle, correct?
Immune
and
bundle.
Those can be found on our website in the
store
section, MeBellaWellness.com, in the store shop section, the shop section. And it's an immunity bundle
with all of those supplements in it.
And these are our products made by, or suggested by Dr. Mia, who
we work with a wonderful company that's been around over 20 years with naturopathic doctors who create these supplements. They are tested. They ensure that they have in them what they're supposed to. And they've been around for a while, so we know they're safe, effective. And a lot of them are actually vegan. So for the vegans who are afraid to take a lot of the supplements, many of our supplements are vegan.
Right. And the reason why we deal with this particular product is because when you go to a lot of these places, you'll get 80% fillers.
Right.
And you're not getting the whole vitamin that you're supposed to be getting. So, and there's one thing you said that I remember talking to somebody about. You said over supplementing,
right?
And I remember talking to somebody who said they was taking something. I think it was. I'm gonna say it was vitamin D, but they were taking so much of it that they was getting the jitters.
Yeah, and B12 will do that too. You can get more like neuropathy and stuff like that. And depending on what supplements you have and what's in them, if it has a lot of caffeine or anything like that, if you overtake.
So they was getting the jitters to where they was like this. So they stopped taking the supplement, but really because they were self-directed with the supplements, they were taking way too much. And they went back to taking the supplement, and they do use our product, and they went back to taking the supplement, and they're doing fine with that. I think they do 1 a week or something like that.
And then some other important supplements for our age group in this midlife journey. Don't forget about omega-3. Omega-3 works really well for
your age group. You're older than I am. Let's keep it moving.
For protecting the heart, for protecting the joints, the brain. Omega-3 is really good. There's actually a good prescription omega-3 called Vasipa. We do have one in our line as well. But that's a high quality omega-3 is going to be good for our age group. We already talked about it, a lot of the immune things. And then for those who are actually trying to lose weight, for example, we have an excellent weight management bundle that I used throughout COVID that helped me to actually lose my weight. Of course, it was really me being able to eat my breakfast in the first hour, eating my frequent small meals, paying attention to my calories. But those supplements really aided in helping to control my metabolism and improve it, increase it, helping me with my appetite and my satiety. So we have one that's called CLA. And it is the lipoic acid and an alpha lipoic acid. Those two are definitely going to help with your insulin levels, your sugar levels, your skin, as well as your weight management, because the alpha lipoic acid actually helps you to hold on to muscle. So in that weight management bundle, we have several different supplements that work really well to aid in your weight management journey.
So why are supplements important? Why is it important to supplement our vitamins or these different
supplements?
There's different things we need in our body.
Because our food doesn't always have the proper nutrients in it. And so since you can't get all of your nutrients from food based on your diet or based on what food you're eating, how that food is processed, you need to supplement to make sure that you are getting all of these supplements. Because if we were eating a healthy diet back in 1965, many of the nutrients that we're talking about that we're having to supplement now were actually in our food, and we didn't have these issues. That's why vitamin D3 deficiency is such an issue. We don't absorb it as well. You know, we're not getting it naturally anymore. We can't use the sun to help us with our vitamin D3. So now we have to supplement it. So we have to supplement because our food does not have the same nutritional value as it once did. And so to make sure we're getting all of the nutrients that we need for wellness and healthy living, many times we're going to have to do that through supplementing our food, even though we try to eat a healthy diet.
So over time, those different nutrients or those different vitamins that we naturally have in our body, do they deplete like testosterone?
Yeah, some of them may deplete, but a lot of it is just that we're not getting it in our food. So normally it would have depleted back then, but since you're eating the food with the nutrients, it wasn't a problem. And now that we're not getting those nutrients in our food, they do deplete, you know. But yeah, kind of like our hormones start to decline with age. I think a lot of the nutrients that we're talking about, you would actually get from food. And since our food is just not as nutrient rich as it used to be, we have to supplement specifically for certain things.
Okay. So today we're talking about supplements, hormone health, and intimacy. And, you know, what a lot of people don't realize is a lot of things that we're fighting against when it comes to our immune system and just our weight management and health, we could do naturally with supplements sometimes, not all the time. Sometimes we do need some stronger stuff, but a lot of times if you're on a regular supplement regimen and you have made it a habit to take your supplements every day, then you will be less likely to catch the flu, catch a cold, catch COVID, things like that. Now you still got to wash your hands and you know, be careful about where you are, but using supplements will help you either fight it or prevent it. So, all right. So we talked about our immunity. We talked about our weight management. And then we was talking about, go ahead.
I was gonna say, and we even have stuff to help with the hormones. So even
I was about to get to that.
Yeah.
So let's go to testosterone, like our T support and stuff like that. Let's talk about that and what that does for you, because we provide hormone replacement therapy. But what does the T support and the supplement line DM? What does that help you with when it comes to the hormones?
So the T support is actually made from the Uricoma tree, which comes from Asia, and it naturally increases your testosterone level. So for my younger patients who are like in their 20s or their 30s, and they're just starting to notice some symptoms, sometimes because they've started birth control, which can suppress the testosterone, they can do something as simple as take our T support supplement 2 times a day, and that will help with their testosterone level so that they don't have the symptoms of low testosterone, which could be fatigue and problems with sleep and night sweats and sexual dissatisfaction, mood changes and mind fog. So the actual T support, which is a supplement in our line, it can naturally increase that. And for some of my patients who are doing pellets, I tell them, I got one patient who works out of town a lot, so she may not be able to get in on time to get her pellet. So what I told her to do is to first of all use the T support as she notices her testosterone starting to decline, or as it gets closer to time for her pellet, to do that. And then we also have another supplement called DM, which helps to keep the testosterone from converting to estrogen, which is breast protective. So my patients who are on testosterone cream or testosterone pellets would benefit from doing the DM so that their testosterone levels can remain higher, as well as decreasing their estrogen levels for breast protection and prostate protection for men, and the breast protection for women. So that's a great supplement. We call it DM Plus. It has that broccoli in it, but the main point of it is to stop the conversion of testosterone to estrogen to protect the prostate as well as protect the breast. It also allows the pellets to last longer because it stops the conversion. So the testosterone stays testosterone, which, you know, gives us all those benefits. They help us to feel better and to protect the heart, the bones, the breast, and the brain. So DIM and T support. Another one for my younger ladies or my perimenopausals just starting to have symptoms would be the DHEA. So that's the precursor to all the hormones. So men and women both can take that. But that would help some with your hormonal imbalance and some of the symptoms associated with hormone imbalance. We also have one called Evening Primrose. That's one of my favorites for women who have a significant amount of breast tenderness with the change in hormones, whether that's hormone replacement therapy versus just your cycles in general, where you get a lot of breast tenderness around your cycle. Evening Primrose also helps a lot with your mood and with PMS symptoms. So it keeps you from having all the PMS and the PMDD. And then we also have one called Cycle Balance, which helps to regulate your cycle. So for my patients with PCOS, I have them to do the cycle balance along with sugar control. And those things are going to help lower the insulin levels, which cause the irregular cycles, as well as regulate the cycle so that they're not skipping cycles all the time. And some of my patients have not been able to tolerate metformin, but they can tolerate the PCOS bundle, which includes the sugar control, as well as the DHEA. You could add that to it, as well as the cycle balance.
So as you guys know, metformin is a prescription medication
that we use for
right.
insulin resistance and diabetes,
right.
to keep the insulin levels low.
And the PCOS bundle is an option. Well, some people have to take the prescription, so please do if you prescribe that.
Yeah.
But if you're trying to control it before you get to that point, the PCOS bundle can help you do that.
Right, and you can still take that with the metformin.
Okay.
So even if you're already taking the metformin, you can do the CLA and the alpha lipoic acid and the sugar control to help with insulin levels and blood sugar levels. And we even noticed an improvement in like the hemoglobin A1C with some of those supplements. So even if you're already treating your diabetes because you have full-blown diabetes, those are some of the supplements that you can use to aid in improving your insulin levels and your blood sugar levels.
Both men and women can take the PCOS.
And both men and women can take the sugar control, the alpha lipoic acid, the CLA, as well as the stress relief, which helps with the cravings for sugar. And then, of course, the cycle balance for women to regulate the hormones and regulate the cycle so that they can start back ovulating.
So if you like sweet tea or Arnold Palmer's and you crave sweet tea and Arnold Palmer's, you probably should take that last one. I don't crave it. That's how my sugar comes through drinks, but I don't drink a lot of sugar though. But when I do, I do.
Yeah.
So, so we talked about the immunity. We talked about the hormones. We talked about the PCOS bundle. And what would be the next bundle that we use in our practice that will help people?
It's one that's an allergy bundle. So it actually helps. It's got the olive leaf and it's got a immune boost and some other things that help with the allergies, the lungs, and all of those things. We also have great probiotic that helps with the GI tract. And then for those people who have a lot of reflux, we have some things in there like the Pep E's that help.
Be careful with those probiotics.
Yeah. Some people who don't take them, but a lot of constipated women, they help us a lot. But for some of the regular men, it may not be a good option. They just have to may have to monitor more because the probiotics don't just help you go to the bathroom, but they also help regulate your gut
like
flora.
Drinking a whole 2 cups of prune juice.
Right, but it depends on how much you take. So he could take one. And he may not take that one every day to help with his gut flora, but he wouldn't be the person to take 2 a day, every day, because that would mess him up
real bad. Okay, so we're talking about supplements today, and our hormone health, and this is a great season to talk about it because this is a season where we talk about weight management a lot, and what goes with weight management also go with working out. And also, you're going to be in areas during this season where you need to protect your immune system. You need to protect your immune system. So, and then on top of that, when it comes to your hormone replacement and things like that, you need to know what else you can do to keep your testosterone at a decent level. And I don't do T support. I probably should do T support, but I don't do T support. But I manage my hormones pretty well. Doc manages my hormones pretty well, but it is something, if you're a busy person and you can't always get your appointment on time, is something that you should have in your little baggie, in your little baggie.
And then remember, the best way to remember them is to plan, kind of like you meal prep, supplement prep.
Create a habit
and do your supplement prep on Sundays and Thursdays, and just go ahead and make your little baggies up. The ones you take for this season. Again, you may not take the very same supplements every single day, but some other ones also help with mood. We have some to help with mood, like the mood and appetite. That helps with emotional eating. It's got the 5-HT in it, or serotonin, so it keeps you from craving as much. You can take it in the evening. It helps.
Talk a little bit more about that, because we are talking about weight management from now until the end of February. So talk a little bit about the mood support and the other ones in that line that help you with the eating and the craving and stuff like that.
And then there's MetaBoost. So MetaBoost is one that has the Garcinia cambogia, the African mango, the green tea, and one other thing. But it actually helps with energy and it helps with metabolism.
Right.
And it helps with the desire to eat. So it helps with appetite.
Yep.
So that's one of the main ones. You could take the MetaBoost 2 in the morning and 2 in the afternoon. Some people don't need that much and they may take 2 depending on what other things they're taking to supplement. The other thing is the alpha lipoic acid and CLA that I talked about. So those are going to help with your muscle mass, your insulin levels, your blood sugar levels. Then we have the stress relief, which is great for those people like me who crave sugar. And who like sugar and salty and all those things, but sugar to decrease your desire for carbs, the stress relief can definitely help with that. And then then the other one is sugar control. So if you know you have insulin resistance, we checked your hemoglobin A1C, it's over 5.5, even though it may be normal, you know you're insulin resistant. So doing the CLA, the alpha lipoic acid, the sugar control, the stress relief, those things are all going to help with your insulin levels. And remember, when your insulin levels stay high, it's really hard to lose the weight. So by taking those supplements, they help to lower your insulin level, lower your cravings for sugar, decrease the amount of sugar that you're eating and the carbs. And so that's going to overall help with your weight management.
Right.
And then 2 other good things that I really found it helps, because I do have a tad bit of ADD. And so with that, I take medication for ADD, but we also have a focus and memory supplement that works really well to help with your focus throughout the day. And then we also have a couple different ones for energy. One that works on your adrenals and it helps to boost your adrenals. So that helps with your energy. So all kinds of supplements, like anything that you can think of, we have a supplement for it. And it doesn't mean that you need to take 1,000 supplements a day, but it depends on what's going on in your life,
what you need,
what ailments you're having, and what you need to help with those ailments. And then we can figure out a good regimen for you and add and take away. And I always say, don't start 10 new supplements at the same time. Try one. If that's working for you, then you feel like you need to add another one on, but don't put 10 new ones in there at the same time, because you're not going to know what's working or causing a negative side effect.
If you have a negative side effect, you're not going to know exactly what it is. Doing it. So try one and then add, and then you want to make sure that the one that you're on makes you feel good and it works for you. Because I'm gonna be honest with you, everybody who takes the same supplement is not going to feel the same way.
Result.
It'll have the same results. So just make sure that, okay, this works for me. It makes me feel how I want to feel. It's giving me what I need. I can take this every day. All right. And then if you can notice when you don't take it, that you don't have those, what you're looking for, then that's what you need every day. And again, these are supplements that we sell. And if you're interested, go to mibellawellness.com/shop. And you'll go right to the page, and you can
just put in your ailment, like if it's something for weight, you can put that in. It'll pull up a bunch of supplements, and you can actually read what's in them, and then just kind of figure. But again, I wouldn't try them all at the same time. No. I would slowly do the add in and take away.
And my suggestion is talk to your physician. Talk to your physician. Tell them what's going on, which you should be telling your physician anyway. Tell them what's going on and let them help you decide on which supplements you take. We all should be taking something every day, because again, the food that we're eating today is probably doing more negative things to us than actually they were doing 30 years ago.
Right.
Frosted Flakes don't taste like Frosted Flakes no more, because it's different. The sugar is different in that Frosted Flakes than I was eating 35, 40 years ago. So all that being said, we want to talk to you guys about supplements today, because we're in that season where we're focused on our immunity and being healthy. And we're also focused at Mibella on weight management, because we know everybody right now is eating just as much as we're eating. The only difference is we're not gaining weight because we're managing our weight. And we're going about it the right way because it's physician directed. So we're talking about that. We're talking about our supplements that go along with that, as well as we're talking about our hormones and the supplements we have to go along with the hormones. So if you're interested, again, go to mibellawellness.com/shop, and you'll be able to pick out or just put in what you're looking for, and it'll come up. And then you can call the office and speak to any of our providers about it, or go to your portal and send a message go to the portal and you'll be able to talk to faster. That's faster than calling the office because we're working at the office. So it's faster than calling the office. The other thing I want to say is right now, if you're interested in weight management, because again, we're focused on weight management for the next 6 weeks. If you're interested in weight management, go to our website and you will see that we have consults at a discount price for our weight management program. But January 6th through the 8th.
No. Well, 6th through the 8th.
We will have a challenge. It's a weight management challenge being presented by Dr. Mia, along with some of her guests. We do have a VIP day on the 9th, but the 6th through the 8th,
it's just me.
It's just me, and it's free the 6th through the 8th.
And you're gonna learn everything you need to learn about weight management for 2025.
Right, working out, supplements,
what's worked, what hasn't worked, the things you should be doing.
Mindset. All that will be available to you. The 6th, I mean, it's available to you now if you go to our website, but all that will be available to you through our weight management challenge, the 6th through the 8th. And then we do have a VIP day, which will give you some bonuses. And we'll announce the bonuses probably next week.
And my super friends will be part of the bonuses.
Yeah,
so I got some experts coming in to talk about specific things that they're expert in as far as weight management goes.
All right. So we've talked about supplements. We believe in supplements. We need to get back on track. The best thing is to do, if you do anything for 21 days, you create a habit. So just think about doing it for 21 days and create a habit of taking your supplements. Figure out which supplement works best for you, and stick with that supplement. You do not have to take 10 supplements.
And then read the backs of the bottle, especially on our supplements, because it'll tell you just how to take them, how many you need to take, and when to take them, whether it's on an empty stomach or on a full stomach. Usually what I do is take my supplements after breakfast or lunch, one of my bigger meals, making sure that I'm not taking something that'll keep me up later. In the evening, I make sure I take them earlier in the day, but a lot of times I do better with food because they can make you nauseated on an empty stomach.
Right. All right. So thank you for joining Ageless Intimacy. Ageless Intimacy, Dr. Mia and Joseph. We appreciate you guys. Happy holidays.
Merry Christmas.
Merry Christmas. We hope you have a phenomenal holidays. Eat as much as you want to eat.
And then we'll see y'all at the top of the year. Get ready.
Because we getting in shape.
We getting in shape, y'all.
We all right, but we gonna get in shape.
We're gonna get better because I need to increase my cardio, increase my exercise, and eat healthier more consistently.
I don't want you guys to think that we're on here and we don't do all the stuff y'all do. Christmas coming. We about to have us some oxtails. We about to have some red beans and rice. We about to have us some chicken, some cabbage, some caramel cake. I mean, we about to eat. So, but the key to it is not overindulging.
Right. And not doing it for 2 weeks, doing it for the day of the
well, we're gonna do it for about 3 days tops.
I do 2 days.
We're gonna do I'm gonna do it about 3 days. It's gonna be some cake here. I'm gonna break that caramel cake off. And then it's gonna be some oxtail. I don't know if the oxtail is gonna last because them smoked oxtails.
That's gonna be one day.
Yeah, them smoked oxtails are gonna be off the chain.
And then I'm gonna get up and exercise because I'm gonna work on while I'm off on my sabbatical. That's what I'm calling it, y'all.
We're going 75 hard over here.
Right.
I don't know if she's going 70, but I'm going 75 hard, which is 75 days. No, I'm going 75 medium. Let me not say that. 75 medium. Because 75 hard is working out twice a day, and I just don't have that type of time.
Yeah, 75 hard.
75 medium starting tomorrow morning. So, and we're going to work out every day for the next 75 days. Like I say, you got to create a habit. I'm 54 years old. I'm trying to look 50. I'm not going to say I'm trying to look 35 because that's not going to happen because I had hair at 35. But I'm trying to look 50. So, I wish all you guys well. Let me see if I got any tips for you guys. I don't have any tips for y'all today. Don't drink too much eggnog. And whatever you do, don't drink an eggnog shake.
No, do not.
Ooh, don't
not
do
a
that.
Good idea.
Not a good idea.
But have some things that you enjoy. Like I've been telling a lot of my patients, we get started hardcore at the top of the year. So
I have a tip.
What's the tip? Because my tip don't
love your family.
Yes, and enjoy your family.
Kiss on them, enjoy them. Because these are the times we never know what's going to happen in our lives, in our future. And they're just too important, especially if they're good people. love on your family, even if they're not good people.
Send
them love from a distance.
Right.
But yeah, love on your family and just thank God for them, good and bad, because that's just the way of the world. So be good people,
live well,
age well,
and
have
experience
everlasting intimacy.
It's Dr. Mia and Coach Joseph. We'll see y'all at the top of the year. Y'all have a Merry Christmas and Happy New Year. Bye.
Love, peace, and soul.
And soul.